I'm Claudia Chender, and I'm the House Leader for the NDP Party. We want to tell you a little bit about what we've been up to so far this session and where we're going. Last week we had a busy week. We started off tabling legislation requiring large telecoms to come to the table in the event of a natural disaster like Hurricane Dorian. Many people experienced issues with cell phone coverage and access to their cellular data during and after the hurricane, and we want cell phone providers to be more responsible to the public in those kind of events. We also tabled legislation regulating Airbnbs. We know that Airbnbs are very popular in Nova Scotia. Sometimes they help people afford their homes, but other times they directly contribute to the rental housing squeeze that we're seeing. As MLAs, we hear from people every day who cannot find a place to live, and we believe that this regulation is one place to start in terms of easing the amount of supply of rental units in Nova Scotia. We found a report midweek that confirmed what we had already suspected, which is that the P3 build plan for the QE2 hospital is going to make it considerably more expensive than if government had done a conventional build themselves. We tabled legislation calling on the government to have transparency around P3 projects so that we, the legislators and the government, can actually evaluate whether the costs justify the means of using the public-private partnerships. Last but not least, we introduced legislation to change the Occupational Health and Safety Act here in Nova Scotia. We're the last province that doesn't have coverage for workplace bullying and harassment in their act, and we think that that's an omission that's long overdue, so we're really hopeful that the government will make that change. This week, it's all about healthcare. We know that there are serious issues with our healthcare situation here in Nova Scotia, and we know that it's important that as government we deal with those issues and also continue to push to make healthcare more accessible and affordable. We're tabling two bills today, one to make hearing aids available to low-income seniors free of charge, and the other to waive ambulance fees that people are charged that often act as a barrier to emergency healthcare. There's a lot more going on. We appreciate you sticking with us, and tune in anytime to our social media channels or to Ledge TV to find out what we're up to.